pandemics. Climate change not only damage to environment, but also to our health and health systems. The Intergovernmental Panel on Climate Change warns that the global warming should be limited to 1.5 degrees Celsius, and when we limit it, we can save millions of lives. However, minor increase in temperature can have catastrophic consequences for our well-being. Climate change is already affecting our health by leading to deaths and illnesses from severe weather conditions, extreme heat waves, storms and floods that increases vector-borne diseases, cardiovascular diseases, mental health issues, and changes in profiles of pathogens that lead to antimicrobial resistance and so on. And the spread of vectors such as mosquitoes and ticks create and scale up diseases such as malaria, dengue fever, Lyme disease, Zika virus. And warm temperatures create better conditions for these bacteria and viruses to thrive. Disease burden scaling up. These climate-sensitive health issues are disproportionately felt by the most affected vulnerable populations, such as women and children, elderly people, people with disadvantages, migrants, refugees, IDPs, and so on. In this regard, it is very important to prepare health systems, our health system, to strengthen our health systems and workforce, to be ready to the impact of climate change health-related challenges. When we are talking about finance at COP29, we should also focus on that it is very important to finance health systems as well. Funding should be allocated also to pandemic preparedness, response, and prevention. We had a bad experience with pandemic a year and a half ago with COVID-19 pandemic. As you know, nobody nor a country was ready for such a pandemic that transmits so quickly and continuously mutated. So it was bad experience, but lessons learned. A virus, so taking this experience, being ready for pandemics should be a part of our mitigation programs, mitigation plans. We should be ready to increase the beds. We make sure that we have enough beds, hospitals, workforce, healthcare work providers, and laboratories. Otherwise, we will need more money for loss and damage and healthcare services. In other words, prevention is better than cure. We talked about artificial intelligence, AI, in previous session. My colleagues talked about, yes, we are in the 21st century, and why we should not be empowered by the latest technological achievements and innovations such as AI while fighting this climate crisis, health crisis, because climate change is a health threat. And health is a fundamental human right. It is not a luxury, not a privilege, but a basic human right. To achieve health security, clean air and water security are vice versa important. Azerbaijan, my country, has severe problem with pollution of transboundary water courses, transboundary rivers. Plenty of mining industrial facilities in Armenia are located near to transboundary river basins in borders which directly discharge highly chemical toxic materials to transboundary rivers, mainly our Kur and Araz rivers, the longest rivers in the country, and they are transboundary. It causes public health issues, increases cancer cases, and it also damages to agriculture. When they use these damaged highly chemical toxic materials, river riversides from Aras river's water for irrigation purposes. As a signatory to UN ESPO Convention, Aarhus Convention, as well as Transponder Rivers Convention, Armenia is obliged to consult with neighboring countries to get a consent when their activities have a transponder impact. But up to date, Azerbaijani side didn't see it, and again, not participating at COP29, it means to avoid from the implementation of their commitments and their added value to negotiations. Azerbaijan defined their own sustainable development goals. Azerbaijan 2030, national priorities for social economic development. We have priorities and goals defined in these SDGs, including green growth, healthy lifestyles of citizens of Azerbaijan. And we have 14 COP29 initiatives proposed during COP29. One of them is investing in human capital, education, and health. By the way, tomorrow is Health Day at the COP29, and we will see plenty of events, meetings around health. We can see more global health actors in this venue. So investing in human capital, health, and jobs for climate resilience future is one of the COP29 initiatives, which ensures investment in education, skills, and health and well-being. The third Global Oral Health and Climate Action Conference starts tomorrow. We are all aware that climate change conferences has increasingly addressed the urgent need to health challenges, demonstrated through the health-focused outcomes from COP27, COP26, and COP28, and namely establishment of Alliance for Transformative Action for Climate and Health, ATACH, for building climate resilience as well as low-carbon sustainable health systems. Taking into account the importance of health in climate change agenda, Azerbaijan declared its co-convener for 2 years to ATACH for 2024-2026. Azerbaijan invites all countries to join this alliance to facilitate our mutual efforts in building climate resilient future. In 2023, Azerbaijan also initiated establishment of new 2 regional cooperation tracks within the framework of UN Special Program for Economies of Central Asia and Azerbaijan, SPECA. And our 3 cities are participating in WHO Healthy Cities program. Azerbaijan is malaria-free country. We got certificated last year as a malaria-free country, and our health system is affordable, accessible, and qualified for our residents after application of state health insurance system in our country. As parliamentarians, what we can do to accelerate climate action and what we can do to address the climate change related health issues, health challenges. Well, we can include innovative, accessible, affordable, and people-centered health services into our legislations, our laws. As parliamentarians, we also represent some group of people at the parliaments. We represent their interests and their needs and challenges. We represent also climate vulnerable groups, populations in our parliaments. So we are voice of them. And we can propose new laws to have more educated people, more educated healthcare providers that have climate change, environmental protection, knowledges as well as health. Also, we have a unique opportunity to propose to advocate to increase health budgets in our countries, national level, mostly to increase preventive measures in our countries. Also, as parliamentarians, we can support each other in international platforms with our advocacy. For example, advocating for to stop pollution of transboundary rivers. And we can strengthen our parliamentary diplomacy in climate change. Because pollution in one place is not limited. It has also cross-border implications. We have common atmosphere. We have common planet. So we should protect our planet together. And as our role as COP29 presidency provides an important opportunity to engage with parliamentarians as well to advance climate action for the benefit of our planet. Thank you for your attention. I will stop there and let's discuss together again. Thank you.
Thank you very much, Ms. Valiyeva, for such an inspiring speech, and also some of the context within Azerbaijan, and most of all for reminding us as parliamentarians from all over the world that we're so interconnected. I think you used the language at the beginning is, when it comes to climate, like many other things, there are no borders. And you reminded us very clearly about the issues of disease, malaria, Zika virus, and of course, all of us in this room have been affected in one way or other by the impact of COVID. And the chances of the impact of climate with regards to disease and how that will increase. So I really appreciate comments. I'm sure everyone in this room has appreciated that also. And I'd also like to thank our other two panelists. And a round of applause, please, for a panel.